Yeah, sleeve gastrectomy is one of the commonest weight loss procedures that we perform nowadays. It's been around now for more than 20 years, so it is scrutinized and well established. It has proven to have excellent results in terms of weight loss. It provides sustainable results in the long term and a very good quality of life for our patients. It's been performed for the vast majority of our patients through laparoscopic keyhole surgery. It's a relatively straightforward procedure which involves removal of the majority of the stomach, leaving behind a stomach that has the shape of a sleeve or like a small banana if you want. It used to be considered as a restrictive procedure, but now we understand that sleeve gastrectomy does not actually work via restricting the patients to eat. What happens after sleeve gastrectomy? Undigested food does not stay for a prolonged period of time into the stomach because of the shape of the stomach. As a result, it goes quicker to the bowel, and that triggers negative feedback signals from the gut into the brain that reset the metabolism and provides significant weight loss. So basically, sleeve gastrectomy changed the hormonal and neural signals that go from the gut into the brain in order to reset the patient's metabolism, and this is how we achieve significant and sustainable results, because actually with sleeve gastrectomy we treat the root cause of the problem, which is deregulation of the metabolism in the brain, rather than considering this as a lifestyle or self-inflicted condition. I will say any patients that have a BMI above 35, especially when they have obesity-related comorbidities like blood pressure, diabetes, osteoarthritis, sleep apnea, PCOS, etc., they are good candidates for this procedure. Weight loss surgery nowadays, it was proven to be extremely safe. The serious events, they're very low, comparable to any other routinely performed abdominal surgery. The serious events, even now, there's evidence to suggest that they match the serious events from medical treatment or any other treatment for obesity. And it provides probably the best results in terms of weight loss, and also the best results in terms of quality of life and patient satisfaction in the long term. Yeah, obviously the benefit from laparoscopic sleeve gastrectomy is significant weight loss. The patients, they will become healthier and happier overall. In extreme circumstances with very high BMI or obesity-related comorbidities, it even improves the life expectancy of our patients. So basically, it is proven again and again to be the most effective treatment for weight loss and improvement of obesity-related comorbidities like diabetes. Obviously, it is an operation that involves certain risks and complications. Nowadays, we have specialists that have been trained and they have been performing this type of operations for decades and decades. As a result, laparoscopic sleeve gastrectomy has become a very safe procedure. The risk of complications or the risk of mortality from this type of operations, it is not really different to any other commonly performed abdominal surgery. And therefore, all the specialists in any specialty in terms of surgery, endocrinology, internal medicine, and surgery, we all agree that the benefits of weight loss surgery outweighs the risk by far. It is the most effective and the most efficient weight loss treatment at the moment. After laparoscopic sleeve gastrectomy, patients are expected to lose, on average, 60 to 70% of their excess weight, or about 35% of the total weight. Typically, that happens very quickly within the first few weeks and months of the treatment. By patients that might continue to lose the weight, obviously in a smaller rate, up to 2 years. The recovery process from laparoscopic sleeve gastrectomy is quite straightforward. Typically, the patients, they will stay 1 or 2 days in the hospital. In selected low-risk patients, they can even be performed as a day surgery procedure. It does involve general anesthetic, which nowadays is extremely safe. The patients, they will have to follow a special diet 2 weeks prior to their admission, and a special diet the first few weeks after the surgery. they will receive dietetic input and a lot of information with regards to its diets. Typically, the patients, they will be prescribed some normal painkillers to take home that they will need for a few days up to a week following their procedure. And I would expect the patients after typically 2 weeks to progressively go back to all of the regular activities without any restrictions. The laparoscopic sleeve gastrectomy provides excellent and sustainable results in the long term. Patients, they can achieve 60 to 70% excess body weight loss or 35% total weight loss in the long term. Typically, the patients, they will reach the minimum weight within few months up to 1 year from surgery. Some of them, they might experience a minimal amount of weight regain, which is considered normal because the body will adapt eventually from these operations. But the vast majority of the patients, they will sustain these results in the long term. Obviously, we will encourage the patients to engage with their weight loss management team, with the surgeons, with the dietitians, in order to not only achieve the results in terms of weight loss, but also implement positive dietetic and behavior changes in order to maximize the results and sustain these results in the long term to avoid weight regain in the future.